السلام عليكم ورحمة الله وبركاته. في الحقيقة أشكر الدكتورة البروف لينا الحماد على تقديمها لهذه المحاضرة. وأشكر الجميع لتواجدهم إن شاء الله معنا في هذا إن شاء الله العرض اللي إن شاء الله راح نستفيد منه. سوف أقدم المحاضرة باللغة الإنجليزية لأجل عدد كثير من المصطلحات باللغة الإنجليزية فيفترض يعني ويصعب أحيانا ترجمتها للعربي، فيعني يعذرني الجميع. طيب، بسم الله الرحمن الرحيم. As you know that our topic today will be about the introduction to medical imaging informatics. Thanks to Dr. Lina for introducing me, which is my honor to be introduced by someone like Dr. Lina. And here we go now. We should talk about, when we talk about the imaging informatics, we should first mention the umbrella of imaging informatics, which is the health informatics. The health informatics is a field of science that aims to develop methods and technologies for the acquisitions, the processing, and study of patient data to improve health care system. Also to identify and define and manage and communicate the data and the information and the knowledge. So in general, the health informatics is when you combine three things: the data and the people and the technology. When these three things come together, we can apply it to any field in healthcare system, If we talk about the nursing system, we can improve it. If we want to talk about radiology department, so we can improve it under the imaging informatics. If we want to talk about something else, for example, health information management, also we can apply it to many fields that we are coming in the upcoming slides. We'll talk about it, inshallah. So, as you know, there's three kind of data. There we have a data, the metadata, and the knowledge. If I give any one of you the data, no one of you can read it and can understand this, because it's tons of data, tons of numbers. No one can understand it. People and the users, the human, we can't understand the data because there is tons of numbers that it's not easy, but it's impossible to understand all of these data. So if we add the metadata, which is the data about the data, what does that mean? That means every column has a topic. For example, this is the age. Okay, I got it, all the age. So what else? It's not going to be easy for me to understand it. Then what I need something I consider it as knowledge. I want chart. I want tables. I want pie for statistics. I want something I can understand it. So when we apply this theory with this theory, we combine it with the health informatics, we can improve so many things, so many parts within any field in the health by using the health informatics. So allow me to move on and talk about the branches of health informatics. This is such of examples. This is not all. So we can. There is a field in under health informatics, which is the umbrella. Where there is a pharmacy informatics, nursing informatics, imaging informatics, bioinformatics. I've been seeing a lot of programs, master's programs, PhD programs back in the United States. I'm talking about the United States because it's the only country that I studied. So I'm going to use it as an example. And I've been seeing, since I applied for my master's degree to the PhD, the number of programs is getting increased year by year, not only for 1 year. You can Google it now, and you can see how many programs. You can use the Saudi education, which is the Ministry of Education, وزارة التعليم. You can go and search the programs in the United States in health informatics. You can't imagine the number is getting increased. back to 2004, when President George W. Bush, they came to him and they asked him to pass bill to intensive. They present actually the health informatics field to him. He liked it and he support and he passed the bill to encourage all the health field within the United States to move on forward, to move on and convert to the electronic. We're talking about moving from generation to another generation. We are talking about moving from the past to the future. If we want to talk about the future, then we should talk about then we are talking about the digits. We're talking about the electronic files. We're talking about the electronic reports. So what does that mean? That means we should encourage all the hospitals within the United States to move on and work with the Ministry of Health to convert from the old school to the new school, if we can call it like that. So, but what's the difference between us and them? What is the difference between Saudi Arabia and the United States? The system here is totally different than what is in the United States. Here, all the hospitals, I mean, the reference for all the hospitals is the Ministry of Health. Back to the United States, every hospital working alone. We're talking about the private. So the federal government has no authority to change anything within any privacy hospitals in the United States. So what they should do, they have another thing. They can intensive them by giving them, by encouraging them, if they move from stage 1 to stage 2, for example, from stop using hard copies and go forward and use electronic copy. If you move from this step to this step, we'll give you the number of this money. So I do remember the President George W. Bush, he passed bill. I believe it's in billions. I don't exactly remember the number. So I mean, the hospitals are getting crazy. So they're trying to move on and start to compare from the old school to the new school. And the Ministry of Health in the United States, they just put program. They call it meaningful use. Meaningful use. You can Google it. Go and Google it. Meaningful use from stage 1 to stage 2 to stage 3. Each stage has many requirements. We're talking about, for example, from stop using the hard copy to sharing the information. Imagine now we are in Riyadh and someone of us want to travel next week to Mecca. And unfortunately, in Mecca, he realized that he has to go to the hospital, but he doesn't have his health records. So what should he do? He should contact his old hospital or send someone to his old in Riyadh. Please send copy of my data, of my report, health electronic report to the hospital of Mecca or something like that. But if we going to share it, so we can get access to our health, our record from anywhere, not within only in Saudi Arabia, we can share it with other. There's many applications for that, and there is many. For example, if you want to read more about the blue button. The blue button, it's something that you can upload your give access and give your authority to the hospital to send and upload your record to that. It sounds like iCloud. You see what I mean? So you can get access to this from anywhere, and it's very secured, especially from the health insurance companies. So back here to health informatics. So the pharmacy need health informatics to improve the pharmacy field. They want health informatics to improve their field. So go and find, there's tons of programs, master's program in pharmacy informatics. Go to the nursing. They wanna something that make their work easy, more applicable, more acceptable, the usability, the fluency of the work, more better than what was in the old school in the past. So they involved to the health informatics. So they use this umbrella to move on. Imaging informatics. We're talking about radiology, which is the radiology that I am belong to. So there's now getting numbers of programs in master's degree that being provided in United States and other world and within the world also. So all of these outcomes will come back one day, and or from here, from Saudi Arabia, and they will improve the radiology field. Bioinformatics, we're talking about the genome, the laboratories field. So not only this is just examples. So since we're talking about the medical imaging informatics, as known as a medical imaging informatics, or you can call it radiology informatics or imaging informatics. So imaging informatics, it's when you get benefit from three things: from information science, the data science. Within the information science, we're talking about how to get benefit from the data, how to analyze the data, how to do all of that things. Radiologic science, we're talking about MRI, we are talking about CT, we are talking about ultrasound, nuclear imaging, fluoroscopy, angiography, all these X-ray. So all of these sections need to be improved and to be involved and combine and cooperate with information science and using the computer science to provide and to facilitate the workflow within the radiology department and under the umbrella of imaging informatics. So the contributions of imaging informatics, it aims to improve the efficiency, productivity, accuracy, usability, and reliability of medical imaging service within the radiology department. So if you want to say, okay, how could imaging informatics will increase the productivity? I will give you one example, which was my topic for my thesis for my master degree. If you look at to the waiting list in MRI in any hospitals, I used to work in one of the hospitals, so I want to keep it. So I'm going to mention the name of that hospital. I do remember the waiting list was reached, I mean, to 6 months, something not, it's, you can't imagine. So I do remember one day, or I called to schedule and to make the list ready for tomorrow. So I called the patient and I surprised the patient was, passed away 3 months ago. It's so tragedy, yeah, to hear that. So what's the solution for that? We need to increase the productivity for that, for the MRI section, for the CT section, for the ultrasound, for the nuclear imaging. How could we do that? Do we have to increase the number of for example, of the radiologists? Do you know how much the income for the radiologists that cost the hospital? I mean, they cost a lot of money, trust me. So if we come to the operator of that hospital and said, hey, look, we need to increase the number of the radiologists, he won't approve it because we can't. It's going to cost the hospital a lot of money. So what should we do? We come here. Hey, imaging informatics informaticians, please come here and do something for this issue. We need to decrease the waiting list from 6 months to 3 months or something like that. So what should we do? There's many solutions. One of the solutions is to look around, to look to the something we call it TAT, which is turnaround time that cost the radiologists need to finish writing the radiology report. So we come to him and we see how could they write their report. In the past, the radiologist used to write the report in hand, and you can imagine how many medical errors will be happened because of the typo or something like that, or by if the radiologist uses slang language or no one uses some of the words. So they move forward to something else. They call it they record the voice. So the radiologist just keep recording the voice, and he just pass the record comes to and go to another department. Their job is to type all the voice report. So, and they have to pass it back to the resident or to the consultant to approve it. So it took a lot of time. So here's what comes here. When we come as imaging informaticians, we encourage, and we found there is something we call it the AVR, which is the automated voice recognition system. So what does that mean? The radiologist can write his report immediately now. He can report he can talk immediately, and the machine, or sorry, and the system will convert his spoken word to the written word immediately. This is not all the story. Some of the radiologists use terminology that's been used, I mean, in many countries. So what's the solution? They will have, so if the radiologists use some of these words, there is a message will pop up and will say you should use the other word. For example, if the radiologist use something not common, for example, I don't know what should I mention, but let's say he should use nephro instead of the word of kidney. So in this sentence, so there is a pop message will come to the radiologist and said you should use this word instead of this word. So also, not only the medical terms, sometimes not also the words, also the medical terms. So we need to add something to the system to improve it. So we come up with something, we call it standards. We will talk about the standards after we talk about the backs and risks. But anyway, so this will increase the accuracy of the report and make it more usable. We're talking about the backs and the risks, back picture archiving communication system, the radiology information system. So this solved a lot of things. This software, these systems, networks solve a lot of things within the radiology department. So if you walk in now and go to any hospital and go to the guy or to the lady who's operating that PACS system, you will find all of them has a bachelor degree in radiology field, but they don't have master degree in any they don't have master in for example in health informatics. So these people, I mean, with their background of radiology, they can see the image because the technologists, after they took the image, they upload it to the backs, but it's not published yet. So it's been waited. It should be approved by the guy who's working in the back system to see the image. Is there any problem with the image quality? How is the resolution? How is the contrast? Is there any illustrating? I mean, hide any pathology? Is there any cut in the image? If he approved or she approved this image, then they can upload it. So they have to have a background, but this is not enough for them to work there. They should have, I mean, they should continue and they should have something, we call it imaging informatics, to be professional in their work. Most of them get their experience from the time, from working with someone and has old experience, and they improve themselves. So if we have programs in master, and if you took for the people who's taking I'm talking to the students who's studying now radiology radiology field, bachelor degree in radiology. I'm encouraging you, if you want to work in the back system of the RIS, or work on the GE or SIMIS or something like that, or want to work as a digital transformation director or something like that within under the radiology, consider informatics within your choice for your master's degree. So standards that can, but backs and risks by themselves, I mean, they can't improve, they can't run the image. The image will not be read. For example, if I send you a PDF file and you don't have the file, the PDF software, you won't get access to the PDF. Why? Because you don't have the software needed to be run these files. Exactly that here. If you don't have something we call it DICOM, LONIC, many standards, you can't run the image, you can't open it, you can't get access. What's the DICOM? It's another field, it's another topic within the imaging informatics. So but in general, we should, I mean, that we should mention it here. The DICOM and LONIC are the standards, or some of the standards that can run the backs and the risks. There is a big opportunity for the students, for the workers. So I strongly recommend anyone who's looking for a job, consider this field. So you can apply for many fields. I'm following GE and Siemens and many companies in here in Saudi and in Emirat and Kuwait and back in the United States by using the LinkedIn and to see what other jobs can be offered for our field. So they provide tons of jobs for art, and they are asking for experience if they have in imaging informatics. And I put my classification letter here just to show you, which is my privacy, and I'm sharing with you some of my privacy, so which is okay now. The reason that's because I want to show you that after you get a master's degree in health informatics, you will be classified by the Saudis, هيئة السعودية للتخصصات الصحية. You will be classified still under the radiological technology / medical imaging informatics. As you see, when I got my bachelor degree in radiology, they classified me as a radiological technology. And after I get my PhD in health informatics, they classified me as a still under the radiological technology / medical imaging informatics. And thanks God, alhamdulillah, I was the first male who classified with this. So I opened the door for all of you now, and also male and female. So contribution of imaging informatics. One of the contribution of imaging informatics in radiology field is the filling the gap between patient understanding and radiology report. As I said, there is many applications. There's many applications for imaging, but I want to focus now in my upcoming slides about how the imaging informatics can improve the radiology reports. So for that, I want to explain my story. Before I explain my story, look, topics is not easy to find it easily. You see what I mean? If you want to start something, if you want to start a project, first of all, I totally recommend all of my students to go and read. This is your key. This is your access to understand your field. Go and dig more and find the gap that you need to fill it by yourself. Go read and read and read. So how can you read? Thanks God, all of the articles offer available and free access to the abstract. So you can go and read the abstract. If anything that related to your field, then go and download the image. And here is an example. So some of the articles, I mean, it's not free. So you have to pay for that. But there is another choice. You have, some of the organizations such as universities and hospitals provide free access and they pay for your articles. So how could you know? There is many research engine for that. Let's talk about Google Scholar. So go to the Google Scholar here and get access right in the Google Scholar. After you open the page, go down there in the left bar and click on the setting. After that, go in picture 2, you find the library links, click in the library links and write your university here. I wrote it in Arabic. اكتب اسم جامعتك هنا. Write your university here and click search and find. If you find your university, that means good. If you don't find your university, then maybe your university has a different way to get access to the free access to the article. So go check with the library. I strongly recommend you and ask them, hey, what's the way? And in the image under the last one, which is shows you one example. For example, this is one of my articles, Understanding Patient Needs and Gaps in Radiology Report through Online Discussion Forum Analysis. You find there is an arrow which is in red. It said get IT UWM libraries. This is my old school, and they provide me free access. And by the way, this article is open access. So I think, yeah, I think it's free access. I don't know. Anyway, if anyone interested in this article, I can send it to them. It's not our topic now. But anyway, this is one of the way that you can find the gap and read more about it. And for example, in my story, it started in 2014 when I tried to understand where is the gap. So what should I know? What is the gap that I need to fill it? So I went to 2 hospitals. One is in Saudi and the other one was in Indianapolis, in United States of America. So I went to Eskenazi Hospital and I met many of the radiologists there, and I talked to them, and I talked to the patients. You see what I mean? And then I went to King Fahd Medical City and talked to them, and I asked, what's the problem? Why? So after this investigation, I can call it, I come up with there's barriers and benefits of report writing related to radiologists use of AVR system in Saudi Arabia. And I use the same methodology that been used for another article that they use Urdu as a first language and English as a second language. So I compare my article with their article. And alhamdulillah, I published my paper in 2016 in one of the international conference in Las Vegas, Nevada, United States. So the story is getting more and more. So the people is getting knows me day by day. So I joined Miss Julie and I worked with her in her project. And alhamdulillah, we published the full paper in one of the international conference was in Korea, in South Korea, absolutely South Korea, which is about using cognitive fit theory to evaluate patient understanding of medical image. We used many way to improve our model, which is very similar to CAD system. So after that, I found that there is a huge gap, and I should go and dig more about the article and read more about the articles. What's the problem with the other universities, with the hospitals? Why they don't provide full access? So before I move and I go more steps, I should understand and see how much do they provide and how much they don't provide. So the first step, I contact by phone, by my cell phone. I contact with 110 hospitals within the United States. And I talk to them. I ask them, do you provide full access to the radiology report or not? So I found that 98 responded that they only provide patient with access to the report, but not to the image themselves. And 12 hospitals stated that the information made available to patient depends on the case. So for example, what cases? Cases involve the breast cancer, brain cancer, and renal cell carcinoma, and hospital could offer all available information to the patient. Some healthcare providers, such as Mayo Clinic Health, require patient to receive doctor permission before obtaining access to certain medical images, such as ECG. So I said, oh, this is very encouraging, and it's just encouraging me to go and see what's the gap here. So I start read. I collected tons of papers. I read a lot of papers about that. And after I get all of this paper, should I waste this? I come up with this and said, okay, I got the benefit from that there is a gap. No, I already have data. I already have the articles, good result. So I can publish it. So I publish it as a literature review paper, and I recommend you to go and read it as if you are if you're interested in imaging informatics. I call it for radiology report through patient web portal. And this was my first journal article, alhamdulillah. And after this paper, I found that there is a gap and huge gap between radiology report and the patient understanding. So in order to understand patient understanding, what should I do? So the existing radiology report written for the physician, and also the existing radiology report this is one of the outcomes from my paper, written for the physician, not suited for the patients. Further studies are needed to guide and inform the design of the patient-friendly radiology report. One of the ways that can be used to fill this gap between patients and the radiology report is using social media sites, and this is my second step. So I went to the four common social media platforms, which call Reddit.com and Quora and Wiki Answers and Yahoo Answers. So I searched there for I think 3 months, trying to find what exactly patient want, what exactly patient doesn't want, why the patient doesn't understand their report. So I dig more and more, and I come up with a good result, and and then I publish it in this paper, Understanding Patient Needs and Gaps in Radiology Report through Online Discussion Forum Analysis. And alhamdulillah, it was in one of the best or greatest journals in the world, which is Insights into Imaging. I think the impact factor was 4.5 or something like that. So so I come up with the results. So now I understand there is a gap, and the patient, what exactly the patient wants. So they want this and this and this, without going more in my results. So we can go and read it within my article. So the good news, after I published this paper, people around the world, they're getting to know me. And for example, for example, the RSNA conference, which is very famous. If you're on field in radiology, you will know the RSNA, and I strongly recommend you to follow it. And there is a conference in these days now. I wish I was there in Chicago, so I can attend. So because I was attending this conference from 2013 to 2019 in person. So I love that conference, that it gave me a lot of idea about my field, about the imaging informatics. And every year they provide section for imaging informatics within the RSNA. So one of my dreams is to publish something in RSNA. Look what happened now. They contacted me, and but before we contact, let's finish this the conclusion for my article. So after I come up with my recommendations for this report, now I am ready to design a new radiology report more friendly to the patient. So here is the invitation letter. I received invitation letter from RSNA News to work to do interview regarding my paper. Alhamdulillah, I did the interview and I sent it to them, and they will publish it soon, inshallah. So after that, I moved forward and I start my designing that I am looking to do it, which is about the designing consumer-friendly radiology report using patient-centered approach. This is my the paper, and alhamdulillah, I published this one also one of the good and great journal. Which is the Journal of Digital Imaging. I believe it's 5.5 impact factor. It's eyesight. Alhamdulillah. So here's some of the evaluation of the result. I use this to test. I mean, the idea of the project was to compare the old traditional, or the old and the current radiology report with the new report that I just designed it. So how did I test it? I used these concepts that you read here, understanding. I put quiz for both the group. The study was about what the study design was based on interventional study, which is we're talking about, for example, all the drug with a new drug, how to test this. So you can use interventional study to examine these drugs. So I used the same methodology, the same theory, and I used here. So I used the concept was understanding by using the quiz and cosmetic appearance and perceived the easy of use and acceptance and preference. The result showed that the new design outperformed the current design in all 5 concepts with an overall of the p-value was less than 0.00. So for example, this is one of the old design. As you see, it's a current design actually. You go now and get your report. It's exactly like this. So this is the patient, what the patient exactly gets. So now I'm a radiology or the imaging informatician. So I came here and I designed something like this. So for example, the patient will have access to Atlas image, and here, and I put annotation, and this will be automated. So I will use something we call it artificial intelligence. It will involve, and alhamdulillah, there is a project coming now, working on now, inshallah. We can apply it, inshallah. You can see it, inshallah, within some time, inshallah. So, and the second image you can see, this is the patient. The second image is the patient exactly image, and there is a notation, and it will be annotated automatically. And the second and the third row, you can see 3 images beside each other. The image in the middle is the patient image without any annotations. But what's happening in the right and the left, this is the scenario. This is the scenario. What's the worst scenario and the normal scenario? So we gave him a normal scenario in the left and the worst scenario. This won't answer all of his questions, trust me. This is won't answer, but it will put the patient in the position that he can know what exactly he is in now, and he will be very prepared to meet his referring physician. And here is the report interpretations. So the radiology, this is just a design. This is not, I mean, the final outcome, but it's just a design, and that I tested. When the radiologist write his report, any medical term will be converted directly, will be translated directly to the right side with the terminologies. But if the patient still doesn't understand, there is a link here we can provide with the barcode or something like that, can convert the medical term, the medical jargon into consumer oriented lay language. I mean, from hard language to easy language. And here is the summary. The summary will be written by the consultant, because we can't ask the resident to write the summary, because it's a consultant responsibility. It won't take from him much time. So it has to be simple like this, and will be criteria for the radiologist to write it. And there is some question the radiologist must answer. For example, cause of the conditions, he should answer it. Impact of the patient-physician function, factors that could make the conditions better or worse, self-care service advice. So the radiologist can put anything of that. And we can add something like, if you want a more question, be prepared for the radiologist. And the radiologist has to report, it has to be more comprehensive. So if the patient has a new another appointment, it will be dragged with the same file. For example, next appointment, he will find it. If there is any very important instruction, it will be written like the icons or something like that. This is a brief idea about the instructions. But the most of the rest of the instructions will be written in the barcode. The patient can scan it, and he will get access, or she will get access to the full instructions. And here is one of our benchmark. This is one of the hospitals. They use the same idea, but not exactly our idea, but the same. So the patient can understand his scenario, the contact number, and it's been published, this paper, and it's work. This project, this is the innovation of this project. For example, this is a unique project in the world, the contribution in filling the gap between patients and radiology report. Patient will be increased, patient engagement, patient satisfaction will be increased, improve patient understanding. Thank you all, and if you have any questions, let me unmute all. I will be happy to answer any question, inshallah.
Thank you, Dr. Mohammad, for this informative talk. The floor is to all audience. Please, if you have any questions to ask for Dr. In case there is no questions, may I ask a question?
Yeah, of
course. If possible.
Yeah, of course.
Yeah, the ease of patient reports and the importance of that. Can we use the same concept, please, to ease learning of our students of the radiology report? Is that a possibility there? I'm thinking of something which is multidisciplinary, where we can introduce such a reporting system to our students so that they can easily recognize the abnormalities, understand the intervention if it is possible, and as well understand the signs and symptoms behind these abnormalities? Thank you.
Yeah, thank you, Dr. Lena, for the great question. Yes, of course, but
Dr. Mohammad, can you hear my question?
yes, it was clear to me. Yes. Do you hear me now? Yeah.
Yes, we can hear.
Yes, absolutely. Actually, this I mean, my project was it included so many concepts within the project. So you can apply one of them. For example, using Atlas image, because the Atlas image will create a mental imagination for the radiology image. Because here I'm teaching a course which is RAD 463. This course, I'm trying to apply my theory to them within this semester. So I'm trying to make it easy for them, not to just go and show them the radiology report. I'm trying to show them, for example, Atlas image and something like that. But if we are talking about involve the artificial intelligence to diagnose and to help the students now to read it, I mean, it's not ready yet. There is a software which called CAD, computerized artificial diagnostic or something like that, but it's called CAD. It's been used now by radiologists, but I'm not pretty sure if we can use it for education. But it's good. I will work on that and see how the software, if they give us free access to this system, so we can use it in the education course, something like that.
شكرا لك دكتور محمد. في أسئلة في الشات لو تطلع عليها كرما.
نعم. هل التخصص له مسار عن طريق تخصص الطب؟ هل التخصص فيه مناوبات في المستشفى؟ ما هي أماكن العمل؟ هل في مراكز في السعودية للحصول على الدكتوراه والزمالة؟ So many questions here. هل التخصص له مسار عن طريق تخصص الطب? If you talk about medicine school, yes, I've been seeing so many. Actually, الحرس الوطني, they're providing master degree in health informatics. They used to only accept MD students, those who has a bachelor degree in medicine field. But now I think they can hire, they can accept and admit another students if you are in for example the dentist or you have bachelor degree in one of our college tracks, so you can, yes, admit in there in الحرس الوطني. And I do believe that King Abdulaziz University, they have a program on that. And here in King Saud University, we used to have one in the College of Medicine, but I don't think so. They accept. I mean, they're rolling or they are admitting any new students for this semester and the upcoming semester. I have no idea about them. Their job, as I mentioned early, how to work. If you are talking about the imaging informatics, you can work in the backs. You can work as an operator. You can work in any head of any radiology department. To be operator for any famous companies such as GE. Actually, GE now is hiring, providing jobs for imaging informatics now. You can check it on their in LinkedIn. وهل في مراكز في السعودية للحصول على الدكتوراه والزمالة؟ دكتوراه I don't think so. I haven't seen anything, but إن شاء الله يعني someone will surprise إن شاء الله. Thank you for talk. How can we ensure that the same way of writing? If you go back thank you for the question, Mr. Mohammad. You said, how can you ensure the same way of writing report among various radiologists? If you talk about various radiology field, MRI, CT, you can go back and read my article. I tested in many design of modalities, and yeah, you can go back. Yeah, and there is a question for you, Dr. Alina says, is there any certificate of attendance?
شكرا للي سأل على certificate of attendance. حاليا لا يوجد لدينا، ولكن نحن بصدد عملها، ولكن حيكون للمحاضرات والورك، حتكون للورك شوب اللي مدتها أطول من مدة المحاضرة، لكن حاليا لا يوجد. هي فقط مبادرة تبادل المعرفة الإشعاعية، وهي أحد مبادرات التعليم المستمر في قسم العلوم الإشعاعية. إن شاء الله في المستقبل حنرفع بطلب للكلية، نشوف إذا كان في إمكانية للحصول على شهادات حضور لمحاضراتنا. شكرا لكم. طيب، طبعا احنا نشكر للمرة الثانية الدكتور العريفي على المحاضرة الشيقة اللي استعرض لنا فيها رحلته للتعلم، وكيف هو استطاع بجهوده انه وبملاحظاته انه يقوم بعملية البحث في المجال الانفورماتكس، ويقدم على العديد من الأبحاث ويقدمها إلينا لنستفيد إحنا من الخبرة. أشكر له وأشكر لكم جميعا الحضور، وإن شاء الله نراكم بإذن الله في محاضرات أخرى. شكرا للجميع، ويعني إن شاء الله يكون يومكم جميعا سعيد ومثمر. السلام عليكم ورحمة الله.
شكرا دكتورة، مع السلامة.